Hey everybody, welcome to our Facebook video. Today I'm talking with Dr. Eric Bush, who's the Chief Medical Officer for Hospice of the Chesapeake and Chesapeake Supportive Care. So first of all, thank you, Dr. Bush, for joining me via Zoom to talk about making healthcare decisions in advance. So I appreciate you taking time out of your schedule to come and talk with me.
Oh, thanks. Thanks for having me here today.
So I think the first thing to talk about is related to COVID-19, the coronavirus pandemic, and sort of the idea of why it might be more important now than ever to talk about, figuring out your healthcare wishes ahead of time.
Sure. So it's always a very pertinent topic, but especially given what's going on with COVID-19 worldwide, we're close to 2 million cases globally at this point, roughly 600,000 in the US. And unfortunately for all of 2020, COVID-19 has now surpassed all other illnesses as the leading cause of death at this time, which is really, just heartbreaking to think about. But it really does make you think about more and more, if you get to that point in your life where you're getting to the end of your life, what things do you want done? What things do you not want done? From a quality of life perspective, what would you or wouldn't you want? Because there are risks versus benefits for everything we do in medicine, just like the rest of life.
Right.
Who would you want to make decisions for you, depending on where you're at this point in time? Because we do know that, unfortunately, those who are older and who have multiple medical comorbidities prior to COVID-19, if they do contract it, that there is a higher mortality rate, unfortunately.
Right. So those are, just to break down the medical speak a little bit, comorbidities are people that might have additional medical concerns, medical issues?
Correct. Additional medical diagnoses that your primary care provider or other pertinent specialist physicians may have diagnosed you with, whether it's emphysema, congestive heart failure, hypertension, coronary heart disease, asthma, things such as that nature. So the more of those that you accumulate, plus if you are older, so unfortunately in particular those over 80 and that have multiple medical diagnoses and then contract COVID-19, there is unfortunately a higher mortality rate.
So those individuals, I'm guessing, are probably living with like a lot of fear and kind of figuring, what can I take control of, right? Like there is, overall, we're all sensing this lack of control.
Exactly. So it's a very anxiety-provoking time. I've been in hospice and palliative medicine for 15 years at this point. And the one thing that I see as patients come closer to end of life is need for control, because what happens is as you lose your physical capabilities in that sphere, that domain of influence that you can exert over things that you can control, as that becomes less and less, the things that you can control becomes more important to you.
Right.
And by having these I know they're difficult conversations to have, but it's really best to have them ahead of time on the couch at home, at the dinner table, right, instead of in the ICU once your loved one is on a ventilator.
Well, and I'm thinking too, even with the way we're having to distance ourselves and people aren't allowed in the hospital, like having these types of urgent conversations are even harder because
Correct.
You're not able to
Correct.
be in the same room with your loved one. So
right.
it seems like it would make it more significant to, yes, while you have the opportunity to really start having the conversation.
Correct. Absolutely.
So what are some things when you're talking about making healthcare decisions in advance? Let's talk about some of the terms that we hear with
Sure.
that. First of all, I've heard advanced directive. Can you sort of explain for everybody what that is, what that encompasses?
Sure. Well, actually, I'm going to back up one more step from there and so first there's advanced care planning, right?
Okay.
Which is more global regarding advanced directives. Then within advanced directives, there's things like living wills and healthcare powers of attorney. And then further, you have things like the MOLST form or the medical orders for life-sustaining treatment. So to break it down into more simple terms, advanced care planning is really the process of laying out your living will or advanced directives, what you would or wouldn't want done, who you would or wouldn't want to make decisions for you, what that time would be. And advanced care planning really should be an ongoing process, because your advanced care planning for someone who's healthy and in their 20s should be a lot different than someone who maybe is older and has multiple medical comorbidities. Should be a different take on it, but it should be something that should be updated on a regular basis. There's no specificity, i.e. doesn't need to be every year. But, you know, as you go through different experiences in life, you tend to look at things a little bit different through that lens,
Right.
and where you're at. So that's advanced care planning.
So that's kind of up here. That's the
Exactly.
Okay.
That's a 30,000-foot view, and then as you get in kind of closer and closer to the ground, so to speak, there are advanced directives, which are written directives in with regards to things such as living will or healthcare power of attorney. So a living will, again, what you do or don't want done. Do you want fluids? Do you want artificial nutrition? Do you want to be intubated and ventilated? Do you want, what kind of pain management do you want? Regardless of whatever happens, whether you want to be ventilated or not, do you want to make sure that you are kept comfortable? Healthcare power of attorney, who would you want making your healthcare decisions for you, which is different than your financial power of attorney.
Right.
And that's one thing that, you know, I see a lot of people will designate one but not the other and think that it encompasses both. And unfortunately it doesn't. So it's important.
It's two very separate.
Exactly. So it's important to lay out who you want making healthcare decisions for you versus who you want making financial decisions for you. That is important.
So when, I'm going to back up a second. When you were talking about the living will, that part to me sounds more like really thinking through about what your options for healthcare interventions might be.
Correct.
And really just trying to make sure you understand all of those menu of options that are out there for if you needed them, and at different stages of life, is what you were saying, is you might need something, you know, in your 80s or not in your 20s, like, or vice versa, whatever.
Right.
Okay.
Right. Depending.
Okay. And then you mentioned the Maryland Medical Order for Life-Sustaining Treatment, or the MOLST form. How is that different than the advanced directive living will piece?
So everybody in the state of Maryland, let me back up a minute again. So number one, medical orders for life-sustaining treatment, each state has their own version.
Okay.
And those are generically termed POLST, or physician orders for life-sustaining treatment. Maryland's version is called the Maryland MOLST, or the Maryland Medical Orders for Life-Sustaining Treatment. On that, there's many different subsections. On the front, generally indicates what you more globally would or wouldn't want done. So if your heart were to stop, if your breathing were to stop, would you want to be resuscitated? Would you want things such as mechanical ventilation? Would you want BiPAP or CPAP? And that's generally the front part. Whereas the back talks about further medical interventions such as blood transfusions, dialysis, antibiotics, some of those other interventions which maybe aren't needed as acutely as what's on the front side. The important thing to note is that if you do not have a MOLST form completed, the emergency medical services, emergency medical technicians, that if they were to come to your home, or, you know, heaven forbid, if you went down on the sidewalk or whatever, what have you, unless you have those delineated, they are held bound by the state of Maryland to do everything within their power to try to bring you back, whether you want or not. So that's why, again, depending where you are with your health conditions and on that spectrum of life, it's just another important piece of denoting what you do or do not want done.
So I'm going to tie this back to COVID-19 is that, I mean, all the interventions that are happening for those people that get really sick with the coronavirus, some of these interventions are coming into place. They're like ventilation, so these are for anyone, they're important things to really sort of think about and talk about.
Correct, absolutely. Because, unfortunately, recently I became more of a case of a gentleman who is very elderly, and because he had let his daughter know that he wanted everything done, he unfortunately contracted COVID-19 and ended up on a ventilator, subsequently with a tracheostomy, and is being artificially fed. It's not really clear by what was meant by wanted everything done,
Right.
and whether it included that or whether it was more limited, because again, since those things were not delineated earlier, and it places a lot of stress on this patient's family. And that's the other way to me that I look at this, is that really, please, there's no better way to tell your family that you love them by letting them know what you do and don't want done, because it takes a lot of the burden off them, because they really do love you and want the best for you, and they can only go based on what you've told them previously.
Right.
So having this done, having it delineated as clearly as possible, really relieves your family of a lot of the burden of having to make these decisions when that time comes.
I think you touched on it, but I think it's worth repeating again. For that Maryland MOLST form, that is filled out by a physician?
Yeah, so physician, nurse practitioner, physician assistant. So any medical provider, mid-level or physician in the state of Maryland who has a license, that is filled out in conjunction with discussion with either the patient, or if the patient doesn't have capacity, the patient's either healthcare proxy or surrogate. So whoever is capable of making decisions for the patient, that's how that is completed.
Okay, but bottom line, it would be good for any of us to know what some of these options are, and then to sort of have somebody, a family member, a friend, somebody that we could really talk through and let them know what our wishes are, to identify and to document that, identify that person.
Correct.
So important wise, do you need both the advanced directive piece and the medical order for life-sustaining treatment, or
you do need both.
Okay.
You do need both. It's always important to have consistent information, but always to have more information rather than less. But you do need both. You absolutely need the MOLST form,
Right.
as well as advanced directives.
And again, I think it's worth repeating for those folks that definitely have made the decision and know that they do not want any CPR or any sort of means of intervention, that they would need to have that medical order for life-sustaining treatment.
Correct.
Okay. So let's talk that people are now, okay, yes, I want to have this conversation. I want to figure these things out. It's important to me. What are some next steps? Like, what are some things that resources that they could tap into?
Sure. So it is a difficult conversation to have, but there's a lot of resources out there. The web can be a great source for those. One of them is the Conversation Project that you can find. There's also something called 5 Wishes, which asks a lot of those questions, the kind of care you would want, who you would want to be responsible for your health care. 5 Wishes is legally binding in just about every state at this point in time.
Okay.
So that is also good information. There's prepareforyourcare.org, which has information in many languages, including Spanish. So to help have that additional resource for other members of our community who need that outreach is great. There's a lot of resources out there that's good to tap into if you are having difficulty initiating that conversation.
That's great. And we'll be sure to put all of those in our Facebook comment section so people can access those resources easily. So I think just to wrap up, it sounds like what folks should really kind of three things they should do is sort of understand what their options are, do a little homework and research and learn about what might be the choice for different healthcare interventions if they were to need them, then have that discussion and sort of point someone that could be their medical power of attorney, have that, and then document all of this. So those are like three key. Am I missing anything else? Those seem like three key.
No, absolutely. Those are the three key elements. Absolutely.
Okay.
And again, in the overall process of advanced care planning, it's good to review these from time to time. Doesn't need to be every 6 months, every year, but if you feel differently than you have before, it's a good time to review. And again, have that conversation again with your loved one and make sure that, you know, your wishes are known.
And in a time of the world right now where we really don't have control of a lot of things, this is one way that we can sort of take some action.
Absolutely, absolutely.
Awesome.
And again, you know, prevent your loved ones from having that burden of making decisions maybe on incomplete or partial information, or sometimes, you know, even though we love each other, we misunderstand each other at times.
Right. You might not hear. So yeah, that's a great point as far as even if we have parents that are older, to have that conversation with them, because
Correct.
they might not initiate it, but it would be really helpful for us to start the conversation as well. I think that's a great point. Great. Thank you so much, Dr. Bush, for taking time. I also want to make sure we thank the John and Cathy Belcher Institute for their generous support of the community education programs here at Hospice of the Chesapeake. And thank you guys for watching.
Thanks.